We have already dissected the brachial plexus. We will see the chords of the brachial plexus. This is the axilla which has been dissected now. Here, this is the axillary artery. The part of the brachial plexus which is on the medial side, this is the medial cord, and the part of the brachial plexus on the lateral side of the artery, this is the artery. On the lateral side, this is the lateral cord. Now when we do dissection behind the brachial artery or the axillary artery here, this is the posterior cord. Now the branches of the medial cord here, this is the medial cutaneous nerve of the forearm, medial cutaneous nerve. Then this is the median nerve which is going downwards, and this is the ulnar nerve here. This is median nerve, this is ulnar nerve, and this is the medial cutaneous nerve of forearm. On the pectoralis major muscle is supplied by the medial pectoral nerve. That is also the branch of the medial cord of brachial plexus. Now on the lateral side of this brachial artery here, this is the musculocutaneous nerve. The musculocutaneous nerve will now pierce here below. This is the coracobrachialis muscle. It will go inside, it will supply the coracobrachialis muscle and come on to the lateral side as the posterior lateral cutaneous nerve of the forearm. Lateral cutaneous nerve of the forearm. Now this is the cephalic vein, which is the superficial vein of the upper limb. This is the basilic vein here, and just on the lateral side of this axillary artery, this is our axillary vein. Now on the posterior side of this axillary artery here is the radial nerve. The radial nerve will come from the posterior cord. It will lie in front of the latissimus dorsi and teres major muscle. This forms the posterior fold of the axilla, posterior axillary fold. The radial nerve will come in front of this fold. This is the radial nerve. Now the radial nerve will go on to the spiral groove of the humerus and will supply the three heads of the triceps on the posterior side. Here, this is the long head of the triceps. Then this is the medial end of the triceps, and this is the lateral end. The three heads of the triceps will get inserted on the superior surface of the olecranon process of the ulna. Okay. Now we will see the cubital fossa. The cubital fossa is a triangular depression just in front of the elbow joint. It is having the lateral boundary, medial boundary, and imaginary line which forms the base. The apex is pointed downwards, which will be formed by the union of the lateral and medial border of the cubital fossa. The lateral border of the cubital fossa is formed by the brachioradialis muscle. The medial border is formed by the pronator teres muscle, and the base is formed by imaginary line which will be drawn from the medial epicondyle of the humerus to the lateral epicondyle. The apex is pointing downwards. Now just when we started dissection, initially there was the skin, then we removed the superficial fascia. Here now you are seeing this is the bicipital aponeurosis. This is the biceps brachii muscle. It gets inserted in the form of bicipital aponeurosis, and the biceps brachii is inserted on the radial tuberosity of the radius bone. Now the contents of the axilla. The contents of the axilla is, this is the median nerve, then brachial artery, the brachial artery here is now bifurcated into two. This is the radial artery, this is the ulnar artery. Then this is the bicipital aponeurosis, and here you are seeing this is the radial nerve again. So these are the contents of the axilla. Now when we go on to the base of the axilla, then it is formed by the two muscles. This is the brachialis muscle and one muscle from the medial side, that is the supinator. These two muscles will form the base of the cubital fossa. Now the axillary artery, which is continuation as the brachial artery in the cubital fossa, is palpated for the blood pressure measurement. Then in between the superficial veins, that is the basilic and the cephalic vein, there is the median cubital vein, which is the vein of the choice for intravenous removal of the blood or any intravenous injection. So this is the applied of the cubital fossa. Thank you.